How common is Peyronie's after prostatectomy? How many patients have you seen who've had Peyronie's, and what are the stats around that?
Yeah, Victoria. Well, it's probably good to actually redefine what Peyronie's is. So, in originally, it was always thought that it just meant a bend in the penis or a curve in the penis, but in actual fact, it's any sort of penile deformity that is of concern to a man that is often associated with reduced blood flow. So these could be curves downwards, upwards, sideways. There could be indentations. There could be like a hinging deformity. There could be an hourglass shape, or some sort of difference that was present only after treatment or after an incident occurred. So we know that in the natural, normal population, Peyronie's does occur more often as men get older. So it's a likelihood of about 1 in 10 men across their lifespan will be diagnosed with Peyronie's. It used to be thought to be about 1%, but it's actually more like 10%. So that aside, we then have men undergoing treatment for prostate cancer. And during my PhD, I never intended to actually do this topic, but had one patient in particular that was only 45, and he was very distressed when he presented to me 1 year after his surgery with a severe curve, about a 75-degree sort of spiraling, twisted up to the left. So he'd actually regained his full erectile function, but then couldn't actually do anything with it. So this led me to be curious about, why does this happen? Is this just a one-off situation? And I actually found a collection of papers that described that about 16%, or roughly 1 in 6 men after surgery for radical prostatectomy will end up with this condition, Peyronie's disease, and about 1 in 8 men after treatment for radiation therapy. So it's something that we need to be vigilant about, I think, in education and awareness. And with Peyronie's, it's quite a difficult condition to treat. But if we actually have the ability to recognize it earlier, then we can often treat it when it's at its soft, fibrous stage of change rather than its hard, calcified change. So there's quite a bit in it.
It's fascinating to hear that it's not just bending. I think that's often when you hear about Peyronie's, you hear it's going to be a curvature or a bend, but it sounds like there might be other signs that men could be looking for. I'd love to hear more about that. If somebody's listening to this and wondering, my goodness, I wonder if I'm going to be one of those 1 in 6 post-surgery, what should they be looking for?
Well, I think it's really important to actually do like a self-examination. It might just be once a week in the shower, just to run the hands down the penis, down each side, just to check for any sort of areas of tenderness, or feeling like there's any sort of lumps or harder fibrotic sort of bits of tissue there that weren't there previously or the previous week. So much like women do the monthly breast check in the shower, I think at least monthly, but probably a weekly check for these guys would be a nice way of just being able to pick up anything. Often there'll be a signal of pain as well. So pain in the penis is abnormal and should always be investigated. And there's something called a penile Doppler scan, which actually can measure whether or not, just through a non-invasive test, just by passing the sound head over the penile structure, to see whether or not there's any tissue change. So this can be measured. And that's what we did in my research when we applied treatment like ultrasound therapy as a therapeutic dose, whether or not those bumps and lumps changed as a response to the therapy. So we can do that personal assessment at home. We can be aware if there's any pain. We can go along then to our GPs to get them assessed, and then we can be sent on for scans, and then potential referral to people like urologists or even physiotherapists now for treatment.